Joanne, and next we have Heather Whitson, who's going to report out from the group that talked about improving awareness and messaging for multiple stakeholders.
All right, so we also had a robust discussion about awareness and messaging on many levels. And the slide's not advancing. I know. There we go. So there was some discussion about sort of just the universal goals of any specific message. So universally, we thought that it was critically important that we make the value proposition of any message that we put forward to any stakeholder. The stakeholder really needs to see how they're going to have a return on investment. And so I think that gets back to maybe Anne's last point about really starting to think outside of the I and I metrics, I-specific metrics, but really thinking about what is the impact that vision or loss of vision has on the rest of health for the affected person, but also for the rest of society, for caregivers, thinking about issues such as driving, cost to the system, as well as cost of loss of work and that sort of thing to caregivers, and loss of educational opportunities for children, and making those links and filling in the specific numbers to really make that case. We also felt that there needed to be a unified message from all players within the vision community, and I'll go ahead and sort of say that part of our robust discussion was valid concerns on two sides of an issue related to screening, and while concerns on both sides are valid, the point was made that when this report has been taken to the Hill, the first thing that people ask on the Hill is, does the community agree on this? Is there agreement amongst ophthalmologists and optometrists, for example, on the key messages? And if there's not, it becomes a harder sell to the outside. So when it's a house divided, it's a lot harder to get outside. It was also noted that there are many, many, many messages on which everyone agrees, but we don't want to make sticking points out of the ones where there's not perfect consensus. So then the personal connection. So today we've heard, it sounds like everybody has somebody with vision loss in their family. But those narratives, there was an example of the baby Piper, the little baby that I saw the video too myself, that went around on social media, that got glasses and began to smile because it saw smiles for the first time. Celebrities who have vision loss and can help sort of market the case to the public. And then an evidence base to support some of this message. So that's universal things. All right, and again. I'm not sure. Oh, there we go. All right. So some factors to consider are that it was noted that there's really sort of different messages to across the lifespan. So pediatric vision issues, middle-age vision issues, and geriatric vision issues are all very different. Also, any message needs to be culturally, racially, geographically, and socioeconomically relevant and important because there are disparities across all of those differences. And then sort of noting that there's really an issue with vision health illiteracy and some vision health attitudes. So a term that was used was fatalistic attitudes, especially among people who might feel like, well, a normal part of growing old is getting blurry vision. And so combating that the illiteracy about vision and attitudes, and that this is not just patient and consumer illiteracy, that really some policymakers, hospital administrators, and some in the public health community don't have a lot of training or insight about vision issues. So then we should talk about our low-hanging or the highest import population health messages. So one thing was that every child needs an eye evaluation. Now, I'll tell you, this is right where we fell into the big controversy area. So probably not surprised to many in this room, but there is a division about whether or not the push should be for the lowest hanging fruit, which might be for glasses for all children who need them, a screen for refractive errors and glasses when appropriate, versus more comprehensive evaluation and eye care, which I think all agree is the ultimate goal. But the question is, where do we sort of set our sights as the first goal, and what do we lose if we sort of lower our sights to what feels to be the more achievable goal? But again, saying as a just happy geriatrician who doesn't really have a dog in this fight. I'm not an optometrist or an ophthalmologist, and I don't take care of kids. I think this has got to be worked out and can't be shouldn't be a sticking point, because part of the problem with messaging is when the message is not consistent. Another message that everyone was behind was the imperative for preventing sports, hobby, and combat-related eye injuries with appropriate equipment and eyewear. Primary and secondary eye care to prevent and mitigate loss in adults and older adults. And again, okay. Targeting higher risk populations and conditions for more comprehensive eye care. So that would be higher risk populations by race or by certain conditions such as diabetes or certain age groups. People with chronic vision impairment should have access to devices and rehabilitation that support their independence so that people can be as active and participatory in life as possible, even those with chronic vision impairment that can't be corrected. And then again, a message that resonated with all was that there should be more training in allopathic and osteopathic providers on eye and vision health, at least awareness training. And then here were some actionable steps. So one good idea was to focus on state Medicaid directors. So again, I think there's some parallels to what the first group talked about, was maybe taking our sights away from the federal level for the moment and focusing on what could be done at the state level. And particularly first reaching out to some of the state, and I would say state and community success stories, and Medicaid directors that are already leading successful vision care programs, and asking them why they made that choice with limited resources and how they messaged that effectively to sustain those programs, and then hopefully making those people champions for the messaging campaign going forwards. In addition, looking for other partners in the community, so whether schools, teams, faith-based organizations, the DMV, advocacy groups, nursing homes, that sort of thing, as well as looking to, again, successful population health community like the Vision for Baltimore that we heard about. And then pooling the available resources that already exist. So the iWiki, the Think About Your Eyes campaign, and sort of putting these all together on a single platform. And then the need for some marketing consultation. So coming up with slogans, materials, effective use of social media to move this forward. And then some of the needs and barriers. So there was talk about that we really need sort of a catchy, positive slogan, so that it's not just go see your eye doctor in case you're losing your vision. But things like how you see is how you live, believe you can see. And then a barrier, again, being that our many messages may compete. So part of it is that we're looking at several different, we're looking at screening and prevention. There's a message there. There's a message about eliminating and stabilizing the treatable conditions, so getting people who need cataract surgery or have refractive errors in for treatment. And then there's a message about those who are living with chronic vision impairment and making sure that they have access to care and accommodation to live full and productive, independent lives. And then the issue that I've mentioned, that where there's in some ways, the vision community is at odds with itself, and that makes for competing messages as well. And then there's for some things that we'd like to craft a message around, we probably need more evidence before we can make a strong message. So for example, we know some of the consequences and costs of inaction, but I think we can probably get even clearer and sharper on that. And then the linking between the potentially modifiable risk factors for eye health, so whether it's UV exposure, screen time, et cetera, we don't really have an evidence base, in part because vision has been left out of some of the national surveillance, as mentioned earlier. I think that was it for us.
Excellent. Thank you, Heather. Any comments from the audience or people who were part of that group?
Dr. Ye, you had a couple of other slogans you wanted to share? Okay.
Yeah, I know, we have to credit you for the slogan so far. Maybe we don't need that marketing consultant after all.
They were good slogans.
Charlotte.
Hi, James Cherkasky, Naver. One important part of our community that really hasn't been addressed much today, although they were mentioned in terms of potential devices or therapeutic products for the future, is industry. And of course, industry often is involved in education about certain disease conditions because of their product line, but also many industry participants also have foundations, educational programs, et cetera. And of course, let's just face it, even some of their basic advertising for their product creates an awareness of certain disease conditions. You know, a great example is chronic dry eye. So I just wanted to point out, I was in 2 of the breakouts, and I think this one might be the one that was most applicable because it was messaging. But let's not forget our industry partners and the important role they play already in messaging, but also in our future activities.
Thanks, good point.
Great. Well, thank you, Heather. Appreciate that.